Shweta presentation.
Yes. Good afternoon, everyone. I'll be presenting on endophthalmitis management in a post-vitrectomy silicone oil-filled eye. So this is a case of an 81-year-old male, retired, hypertensive, controlled on medication, who underwent vitrectomy surgery along with cataract extraction in his left eye 2 weeks back. He presented 2 weeks later with complaints of increased redness in the operated eye, increased swelling of eyelids, and diminished vision for the past 2 days. So about history of present illness, the surgery was primarily done for a large submacular and vitreous hemorrhage secondary to PCV with dense cataract. Surgery included 3-port pars plana vitrectomy with subretinal injection of recombinant tissue plasminogen agent, intravitreal injection of aflibercept, silicone oil tamponade along with cataract extraction and PCIOL implantation. So patient was recovering well. This is the anterior segment and the fundus photograph taken at 5th day post-operatively. Vision was improving to 636. Anterior segment showed no reaction and fundal glow and fundal details were clearly visible. At day 15 post-operatively, patient presented with this anterior segment photograph showing intense AC reaction, hypopyon. The fundal details got obscured and vision reduced to finger counting. So we diagnosed this as post-operative endophthalmitis in a post-vitrectomy silicone oil-filled eye with pseudophakia. The patient was urgently taken for anterior chamber tap with anterior chamber wash. We injected intravitreal vancomycin and ceftazidime. Along with that, we started patient empirically on fortified vancomycin, cefazoline, tobramycin, along with oral Ciplox, that is ciprofloxacin. We sent the tap for culture and sensitivity, which came positive for coagulase negative staphylococcus. Fortunately, this organism was sensitive to most of the commercially available antibiotics. This was the presentation pictures, and fortunately the patient responded to the treatment. We also added prednisolone eye drops, initially in low doses after 2 days of intravitreal injection, and closely followed up. 15 days after the intravitreal injection of antibiotics, patient presented. This is the anterior segment photograph showing resolved hypopyon, improving anterior chamber reaction, improving fundal glow, as well as fundal details now getting to be visible. The visual acuity also improved for finger counting to 636. So endophthalmitis in a post-vitrectomy silicone oil-filled eye is uncommon owing to the antimicrobial nature of silicone oil. Although there is a lack of consensus regarding management, traditional methods involved reoperations to remove oil, administration of antibiotics, and silicone oil re-injection. But recent reports advocate the use of intravitreal antibiotics. So how is the silicone oil toxic to microbes? The low molecular weight components are toxic to the microbial cell membranes. Also, high surface tension and low permeability limits the movement of pathogens, concentrates them close to the ciliary body and blood vessels, allowing the defense mechanism to act better, and leads to washout of toxins. And because of silicone oil in situ, we choose a minimally invasive procedure despite the obscured fundal view. So take home message, endophthalmitis is a dreadful post-operative complication which requires timely intervention and prompt action. But in a silicone oil-filled eye, it is rare due to its antimicrobial nature, and one should have high threshold for vitrectomy in these eyes. Also, tap and injection of antibiotics with close follow-up is recommended in such eye if the need for vitrectomy arises in case of worsening. Thank you.
So how do you titrate your intravitreal doses in silicone-filled eye?
Sir, we came, when we were managing this patient, we came across some case series and case reports in which we saw whether we use the half dose or we use full dose, it makes no difference. There was no incidence of any retinal toxicity related to the intravitreal injections of antibiotics. So we gave full doses. And also because we did AC tap, so the pressure increase was also not found.
If you do an AC tap, you said you did an AC wash in this patient.
Yes, sir.
So if you do an AC wash, silicone oil will not come in the anterior chamber if the pressure goes down. So what did you do to maintain the intraocular pressure at the time of surgery? AC wash? AC जैसे ही तुमने खोला उसको ऑयल तो आगे आ जाएगा ना तो?
Yes, sir. Sir, while we were removing the fibrin, We maintained the anterior chamber pressure.
कैसे maintain किया?
So we could have used anterior chamber maintainer, although we
Yes.
didn't use in this case. But
ठीक, good.
thank you.